Hi everyone, I'm Jennifer with Community First ER. I'm here with our medical director, Dr. Rad Miryala. Hi Dr. Rad. So we have a lot of questions in regards to the Delta. Can you tell us a little bit about that?
Yes, so the COVID virus, like all viruses can mutate, and the latest version or the latest mutation is a Delta variant, and this is the one that's most prevalent in our area now. Over 90% of cases are from the Delta variant. The Delta variant is about 5 times more contagious than the previous COVID that we were facing. And this version is also affecting children more than the previous version.
Okay, we also know about the antibody infusions, and a lot of people are asking questions about what that is.
So yes, when your body fights an infection, it makes antibodies. Now, these monoclonal antibodies are specific proteins that are made in a lab. And the monoclonal antibodies for COVID are these specific proteins made in a lab to help fight COVID. Now, we have the monoclonal antibodies available at our ER. The whole process is about 2 hours to infuse the medicine into you and then also to monitor you afterwards for an hour. So it's about a 2-hour process.
Okay, and who should get antibody infusion?
So great question. You have to have a COVID positive test. You have to be over 12 years of age. You should have symptoms within 10 days. So if you've had symptoms for like 2 weeks or something, you wouldn't qualify. Now the thing is, the sooner you get this medicine, the better. So if you start having symptoms, 1 or 2 days, it's more effective the sooner you come than the later you come. But you have to be 12 years of age, you have to have a COVID positive test, you have to be within 10 days of symptom onset. And more importantly, you have to have one risk factor that would make you at risk for having COVID complications that might need hospitalization. So this could be, having some obesity like a BMI over 25, having hypertension or heart disease, having lung disease like asthma or COPD, having diabetes, or any other immunocompromising condition. Now, recently they made another category of patients who can qualify for this, and these are patients who are exposed to COVID, and a serious exposure, meaning that you're living with someone who has a positive COVID test. And so you have a significant exposure to COVID, and not just somebody that you passed by on the street, but a significant exposure of someone with COVID, and you did not get a vaccine. So if you did not get a vaccine and you're exposed to somebody with COVID, a significant exposure, then you can qualify to have a prophylactic dose of this monoclonal antibody infusion. Now, the other condition is if you have a significant exposure, and even if you did get vaccinated, but you're at significant risk of developing a serious complication like hospitalization, then you also qualify. Now, this monoclonal antibody infusion, it's really to help prevent you from getting hospitalized. That's the main outcome that we look for. And so the more people that can get it, the fewer people that will end up in the hospital. Now, as you know, right now, all the hospitals in the greater Houston area are full. It is a big challenge for us when patients who have a significant complication come and need to be in a hospital to get them transferred. So we encourage patients to come to the emergency room early, to get tested for COVID early, and if you qualify for the infusion, to get the infusion sooner rather than later.
Yes, thank you very much, Dr. Rad. We hope that this information was helpful for you and your family. Know that we are an emergency room. We're Community First Emergency Room. We also invite you to visit our website, communityfirster.com.
Yes, thank you.